Many years ago, when I first started in treating people with sleep disorders, I was sitting in front of a physician, and she said, I'm not going to send my patients for oral appliance therapy because it causes temporomandibular joint dysfunction. And I said to her, clearly not. One of the misunderstandings about what I do is people think I'm going to advance or move the jaw forward. And I tell patients that's not exactly what I'm going to do. The reason people have a sleep breathing disorder is because as you get into the deeper stages of sleep, the jaw falls back, the tongue falls back, and that's what blocks the airway. And then I tell them, as you're sitting here right now in front of me, you're not snoring and you are breathing. And you're holding your jaw in a very comfortable, normal position. We call that the awake position. So in the awake position, most people have their lips together, they're breathing through their nose, their teeth are slightly apart, and their tongue is forward in the mouth. All I have to do with my appliance is hold the jaw in the same awake position that you are right now while you're sleeping. And people go, oh yeah, that makes sense. The job of the oral appliance on the sleep side to prevent sleep apnea or a sleep breathing disorder is to prevent the jaw and the tongue from falling back, not so much to advance it forward. So if I hold the jaw in the same awake position that you are right now while you're sleeping, we'll be able to open the airway, stop the snoring, eliminate or reduce the amount of apneic events without causing temporomandibular joint dysfunction, without putting pressure on the biting muscles, without moving the teeth or changing the bite. Can these things ever happen? Sure. In medicine, if it's possible, it can happen. But it would be very rare in our office to cause a TMJ problem with a sleep appliance. Patients should not be afraid to come to the dentist to get a consultation about an oral appliance for sleep apnea for fear that it may cause a TMJ problem. It generally does not. A lot of our patients will have both a TMD disorder and a sleep disorder at the same time. And then it becomes, which do we treat first? Which is my expertise to decide, okay, we're going to treat the temporomandibular joint disorder or the sleep breathing disorder, but as we treat one, the other one gets better as well.